Hello all, this is Dave. I just wanted to do a quick video chair chatter before I leave for Boston. I'm going to be taking a 2-week course for chairs of clinical departments at Harvard, and hopefully I'll come back and be able to do this job better and serve you better because I do work for you. And Jen Phillips will be holding down the fort until I return, and I'll be back on February 8th. Just wanted to share with you and be as transparent as possible some of the really cool things that we're working on, and again, just be thankful to have the opportunity to work with you all. So let me share this with you. So Maureen Smith came from an outside institution at the invitation of Nancy Pondy and our CTSA to help us learn about learning health systems. And I really love this concept, and I want to reproduce it, and we want to reproduce it throughout our institution, where we create learning health systems that take internal data and experiences to systematically integrate with external evidence and our own knowledge to be put into practice. So this is a beautiful concept of how we really combine clinical care, research, and education into a process that we learn from and then improve on. So one of those examples is this project that we're really excited to put our energy towards, that we're going to refer to as Sendero, which Andy Shee came up with, and really honors a lot of the work that you all are already doing in regards to addressing the health needs of at-risk families, particularly for addiction across generations. So since we have so much expertise in our department, as well as people outside our department to do this well, we want to give it more energy and bring it all together so we can really make this a highlight of expertise in our department. So everything from birth in the Milagro Clinic to taking care of the family of that baby that was just born in the Focus Clinic, and reducing the risk of reincarceration through Adobe and Youth Health Services, the Embrace program that addresses mental health needs, and our new Addiction Medicine Fellowship. All of these things we want to try and coalesce into a systematic project that we can share our scholarship with. So I've asked Nancy Pondy, Jenny Hedema, and Andy Shee to come together and look for some funding opportunities that will create this path of work to really improve the health of New Mexico. So they're going to take about 3 to 4 months to do some scoping and see, should this be a center's grant, or should we pursue some other form of funding to really help this grow within our department. So in about 3 or 4 months, we'll bring a lot of you leaders of these programs together so we can brainstorm and really go in a cohesive direction together. Excited about that. I just want to also really provide an update of another example of a learning health system, which is our primary care incentive. And just to remind us that this will change over time. It's not perfect now, but we want to reward what it means to be a family doctor who manages a panel of patients and has inbox work, and at the very least, address some of the salary differentials between cognitive specialties and less cognitive specialties. And I just wanted to remind us that this is the format, and the green means that people met these metrics, but look at the metric that hardly anybody met, which was hemoglobin A1c. And I think this is a great example of a learning health system, because it's not as simple as just measuring hemoglobin A1c. What we want to do is create a process of care that really allows us to come together as interprofessionals to help partner with our patients out in the community to facilitate a process where they are more enabled to take care of their diabetes or even reverse their diabetes. And then the hemoglobin A1c improves as a side effect. So a learning health system looks at the process. And if we're doing the process and the work right, the metric will improve magically. That's the deeper question. We can't just look at hemoglobin A1c. It's too myopic. we need to understand how we can work together to improve the lives and the condition of this epidemic of diabetes that we see every day. So I also wanted to remind people of the stewardship. Remember, this is a go, no go. We require one Learning Central population health stewardship module. Aaron Jacobs promised me he'd keep these less than 15 minutes. But remember, you need one per quarter. So in order to qualify for the incentive. So if we're in the third quarter, you need 3 Learning Centrals. If you didn't do it the first quarter, you need 2 in the second quarter. If you didn't do a Learning Central module in the first or second quarter, in order to qualify for the incentive, you need to do 3 in the third quarter. So I hope that is clear, and we will send reminders because we really want people to get this incentive. I also am really excited about the next stage of Huron. The first stage was addressing how do we improve the hospital system and functioning. The next stage is going to be how do we improve ambulatory clinical care. And if you look at some of the needs on the left side of this slide, we would all agree, I think, that these all need our attention. And on the right side, the purple side, are strategies that we are going to work on together to really improve efficiency and joy of practice in primary care and specialty care. Both need this attention. So I'm excited, particularly since some of our clinics, there was 4 clinics who were pilot clinics for some of the initial work on this. And if we wanted to pick one of the more challenging clinics in our system to show how we can improve the efficiency of care, Southeast Heights is a great example, particularly with the challenges of the social determinants of health, as well as all the translators that we need when we see that beautiful, diverse population there. And I just want you to look at the first metric here. When Huron helped us go in and work with John Bettler and his team to really understand how we can improve the process of care, there was a 41% reduction in average documentation time. So how do we get this to all of our clinics? And that's this next chapter of Huron investment and engagement that I'm really excited to work on with you together. Just a really important thing I want to ask us all to step up to the plate to help with is there's a tremendous need for preceptors, particularly in pediatric and women's health, for our PA students. And we attached Laura Wiley and Lindsay Fox created a letter of ask of how our faculty can help support the PA students who are really a vital, as we all know, a vital part of our primary care delivery system. And we are in need of preceptors to make sure that we ensure high quality education for our valued colleagues in this work. So please read that letter and help if you are able. And lastly, I just was thinking of the process of learning health systems, and I think it's really important that we're going to try, we're going to fail, we're going to learn, and we're going to improve. And that's the definition of a learning health system. There's going to be ups and downs. There's going to be hardships. There's going to be joy. Despite some of those negative things, in the end, over time, we get to a better place together. So I would just like to say how grateful I am every day to come to work with such wonderful people whose mission it is to really improve the lives of others. And someone told me once, and I think it's true, that it is difficult, if not impossible, to be stressed and grateful at the same time. So I pick gratitude. And each morning coming to this institution, I'm very grateful to be able to work with you all in doing this good work together. So thank you.